There are triple negative breast cancers, HER2 positive breast cancers, where the guidelines and many trials have been proven that neoadjuvant chemotherapy, that is upfront chemotherapy, 60 to 70% of cancers which completely reduce and it will become impalpable at the time of surgery after neoadjuvant chemotherapy. We need to mark the tumor at the center of the tumor exactly before going ahead with neoadjuvant chemotherapy. Hi, I'm Dr. Kanmani, breast oncoplastic and reconstructive surgeon working at SPARSH Hospital, Hennur Road.
Hi, I'm Dr. Sasikala, consultant radiation oncologist from SPARSH Hospital, Hennur. Here we are on the eve of October Breast Cancer Awareness Month. We'll be talking related breast cancer surgeries.
Sure.
So, as a breast surgeon, what do you feel? Nowadays, breast cancer, we don't treat upfront with surgery. So, we give neoadjuvant chemotherapy and then do downstage and then treat the tumor with surgery. So, as a breast surgeon, what is your point of view about this neoadjuvant chemotherapy?
I mean, with emerging techniques which show what kind of cancers the breast cancer is. So, there are triple negative breast cancers, HER2 positive breast cancers, where the guidelines and many trials have been proven that neoadjuvant chemotherapy, that is upfront chemotherapy, helps in giving better overall survival and less recurrence rate, and also helps in downstaging the tumor, because breast, as we know, is a systemic disease. So in that way, as for a surgeon's point of view, a lot amount of help we also get from neoadjuvant chemotherapy, in sense where, for example, the cancer is more than 5 centimeters or a very large tumor, which technically, if we go ahead directly with surgery, would end up having a complete breast removal, that is mastectomy. But when neoadjuvant chemotherapy to such subtype of cancers are given, we see tremendous amount of size reduction, which helps us to conserve the breast safely and also improves the cosmetic outcome.
Okay, sometimes when we give neoadjuvant chemotherapy, there will be complete response of the tumor. So
That's
when
right.
you open the breast, you don't see any lump at all to remove. So in that case, as a breast surgeon, how you approach such patients?
Definitely, it is paramount to see the breast surgeon also when you're seeing a medical oncologist for your neoadjuvant chemotherapy. Why? Because as a surgeon, as you mentioned, there is 60 to 70% of cancers which completely reduce and it will become impalpable at the time of surgery after neoadjuvant chemotherapy. So in such scenario, where do you go, what part of breast do you take out, and if you have to do breast conserving surgery in that way? That's a very nice thought and very good question, because we need to mark the tumor at the center of the tumor exactly before going ahead with neoadjuvant chemotherapy. So either some clips which can be put ultrasound guided or also mammographically guided. So once a clip is placed in between at the center of the cancer, and then when you start neoadjuvant chemotherapy, at least we know where the tumor was. If there is complete response, as I said, around 60 to 70% of cancers do respond very well with neoadjuvant chemotherapy. So which helps during surgery for us, that where the tumor is. On mammograms we can locate it, on even ultrasound we can locate it, and we can put some MAC seeds or some radio isotope tags or a wire to locate it during surgery.
Okay, as you said, pre-op localization before chemotherapy is really mandatory for the surgeon to operate. Being a radiation oncologist, for us also to target the radiation post lumpectomy, when the surgeon put the surgical clips, it will be helpful for us to target the radiation. So to conclude this, I think now the approach of breast cancer is a systemic disease, and we should approach in a right way to get a good outcome.
Yes, it is definitely teamwork. Because if you directly start chemotherapy, and then surgeon will be a fix where to do, what to do. So definitely a surgeon should be breast surgeon specifically should be involved during the tumor board or MDT discussions, where you discuss each and every patient, and it's a comprehensive care which helps to give better cosmosis and better oncological safety.
True. Yeah.
Thank you so much everyone for listening to us. This October month, as ma'am mentioned, is a health awareness month. Please feel to contact any of us or SPARSH Hospital, Hennur Road, for any further queries. we will be available every day of the week. Thank you.